Well, we're coming up on the end of February, and it is a month dedicated to raising awareness about heart disease. Heart disease is something that impacts a lot of people in a lot of different ways. And this afternoon, we have ProMedica Cardiologist Dr. Hanna here so we can learn a little bit more. Thanks for being here today.
Thank you so much for having me, Amanda.
Yeah, it is Heart Month. We're talking about the heart this month, and we would be remiss if we didn't talk about something specific that a lot of people may not know about, because I know when I think of heart disease, I think of clogged arteries.
Absolutely.
A lot of people do. But there is something called structural heart disease. What is that?
Yeah, so structural heart disease is a branch of cardiology that has to do with the structure of the heart, meaning the walls in the heart and the valves of the heart. And structural cardiologists are actually general cardiologists that do interventional training and then additional training to do structural. So we actually deal with clogged arteries, but then focus on mainly the valves and the walls of the heart. That's
specialized, which is good, because if you're a patient, you want your doctor to know a little bit the most about what it is that you need to be treated for. So what are some of the risk factors then for maybe structural heart disease over, other issues with arterial and things like that?
So similar to arterial disease, one of the biggest risk factors is actually age. Some patients are born with structural abnormalities, congenital abnormalities such as a bicuspid or an aortic valve with two leaflets. Sometimes structural heart or valve problems are a downstream or a long-term effect from having rheumatic fever as a child or having a heart attack. But mainly age and wear and tear on the heart valves is one of the biggest risk factors.
Yeah, and father time, not always
undefeated.
Exactly. So these things, I mean, we're not the same as we were when we were babies. So how do you go about treating different conditions when it comes to the structural issues?
Yeah. So we actually work very closely with our heart surgeons, and many of our patients are in their 60s, 70s, 80s, and 90s. And we actually approach every patient individually using a heart team approach. So we work closely with our heart surgeons, we work with our general cardiologists, with our nursing team to take care of these problems. And many of the problems that we'll encounter in the clinic have to do with a stenosis, which means a tightening or a narrowing of the valve, or a regurgitation, meaning a leakiness of one of the valves. Again, many times we evaluate these patients from both a surgical and a percutaneous. And as a structural heart doctor, we do the procedures percutaneously, meaning we usually go in from the artery or the vein in the leg, sometimes in the arm or the neck, with a catheter, and we can do the procedures, the valve replacements and the valve repairs through a minimally invasive approach.
That's kind of cool.
Yeah, pretty amazing.
And when you think about the recovery time with that seems like a way easier than open heart surgery.
Yeah, I think for the right patient, definitely most patients are out of the hospital in 1 to 2 days. And I think for the right patient, going a minimally invasive approach has definitely changed the game.
And you did something kind of cool recently at ProMedica, yeah?
Yeah, we were very lucky. It was a big team, but we were very lucky to help this patient with a leaky tricuspid valve. So severe leak in the right side of the valve, of the heart, the tricuspid valve, and they had severe swelling, bloating, fatigue, and shortness of breath. So symptoms of heart failure. They couldn't undergo open heart surgery or another repair, and we were actually one of the first programs in the country that weren't involved in the research trial to implant this Evoke tricuspid valve. So we went in from the vein in the leg with the catheter, and we implanted the new valve in place of the old valve and reduced that leak from severe leak down to nothing. And the patient was out of the hospital in 2 days, and they were doing very well.
No kidding.
So, yeah, we were very happy and very lucky to offer this to our patients. Outside of this, we're kind of the busiest and most established program, but outside of ProMedica, patients would have to travel to U of M or Cleveland Clinic. And honestly, all our physicians are trained at U of M or Cleveland Clinic or Mayo. We're all very well trained, and we're connected with those programs, so we definitely advocate for our patients to get treatment there when they need to, but we're very excited and very happy to offer these treatments to our patients here in the Toledo area.
Yeah, make it easier for them, that travel time or the family situation.
Absolutely.
It's nice that we have that ability to receive that kind of care here in the Toledo area. So for people out there, what kind of symptoms or things should they be looking for, paying attention to go see the doctor?
Good question. So many patients actually manifest with shortness of breath, sometimes swelling in the legs, sometimes lightheadedness or fatigue. And with their primary care physician, many times their primary care physician, when they take a listen to their chest, they'll hear a murmur. And a murmur is kind of one of the signs that a leaky valve or a tight valve may be developing or may be there that may need further investigation.
You'll definitely go see your doctor regularly, like we're supposed to, and pay
Absolutely.
attention to our bodies as well.
Yes,
yeah.
ma'am.
Doctor, thank you so much for being here today.
Thank you. It was a
pleasure
pleasure.
to meet you.
Pleasure's
Yes,
all mine.
yeah.